We seem to have a couple issues, so Cheryl, let me know if you are hearing this, please. And she's here. So, all right.
So officially open the meeting at 18:04.
Great. And did you all receive the minutes from our previous meeting?
Yes.
Yes.
Yep.
Want to go ahead and review and approve those, please?
Motion to approve.
Second. All in favor?
Aye.
I think we have to
Aye.
state our names because we're on Zoom. Juanita Carnes, yes.
Margaret Judy, yes.
Stan Tremco, yes.
Great. Thank you. And also, thanks for that, Juanita. I just wanted to, and I forget this because we're not in person and we don't have placards and plaques in front of our positions. So for everybody that's on the call, we have the 3-member Board of Health, which is Juanita Carnes, it's Margaret Duty, it's Stan Stremko, and I'm the Director of Public Health, Joe Rouse. So that's who we are. So we're gonna go right into public participation, but I just want to do a little housekeeping on that. And we did have, and not just for Board of Health, but for all boards and commissions, we had an opinion come down this week from the law department to just clarify the structure of the public participation of the open meeting. And so I just want to remind everybody, if you're here to address the board, what's going to happen is you're going to have 3 minutes, and I will time that. I will give you a 20-second warning for when that 3 minutes is going to be up. During that time, you have the opportunity to address the board. Try to refrain from asking questions because we by the open meeting laws cannot engage in this part of the agenda. So any question that would be asked would probably be well served to be reserved, and maybe your question will be answered during our discussion of the board meeting. So so I will give you a warning, and just remember, you can address the board and say whatever you want. You have 3 minutes. If one of the members of the board after that 3 minutes decides that they wish to make a motion to extend the time for a specific period of time, then they can make that motion, and by majority vote, the board can extend that public participation beyond 3 minutes to a definitive amount of time. So in other words, if after the 3 minutes, somebody makes a motion to extend the time for that resident to another minute, then that gets voted on, and that's what we do. So it's not a debate, it's just an opportunity for you to address the board. And we're going to be pretty strict with that tonight because we have a lot to get to. So it's 3 minutes per person and maximum of 15 minutes total for public participation. So does the board have any questions on that clarification?
No, thank you, Joe.
Okay.
Thanks, Joe.
All right. So Juanita, if you want to just move on into that public participation piece, I think we're ready to do it.
All right, and how do we go about?
So I
Take
think it's
your
just going to be
speaker
a
off,
matter
or-
of, yeah, whoever wants to, if you want to unmute yourself, I'll kind of see if I can have a hierarchy with that, but there's not a lot of people on video other than us. So let's just see what
I'm not
happens.
seeing any mutes on my screen.
Yeah, if you want to address the board, you can, if you're on video, you can raise your hand. So we'll go with that first. Anyone that wants to address the board, either on video, raise your hand, or unmute yourself.
Okay.
Okay.
Okay, we'll start with Jessica.
And Jessica, you have 3 minutes. I'm sorry, I don't mean to interrupt.
No,
But
that's okay.
I'll give you a 20-second warning because I don't want to be rude and just cut you off at the finite. Yes. Good.
Oh, you've been watching.
So you have 3 minutes to address the board.
Okay, all right. So we'll wrap this up from last meeting and I'll ask some rhetorical questions and you guys can
Can you
respond at
please
the end.
fully identify yourself
Sure.
first?
My name is Jessica Britton and I live at 36 Casimir Street. First, I'd like to address Dr. Shremko. Last meeting, you said the vaccine was safe and effective and VAERS is not consistent with the CDC, DPH, specialty societies, or day-to-day operations for you. You work at Noble Hospital, correct? Do you see severe trauma or specialty cases, or does that go more to Springfield Bay State? Secondly, VAERS is very real and the side effects are very real. I have many whistleblowers within the hospital community that can vouch for that. And just to give everyone a little education on this call, there was a joint study in 2009 done between Harvard Medical School and Harvard Pilgrim Healthcare that looked to see how they could improve the electronic reporting system known as VAERS. And I will quote from this. Adverse events from drugs and vaccines are common, but underreported. Although 25% of ambulatory patients experience an adverse drug event, less than 3% of all adverse drug events and 1 to 13% of serious events are reported to the FDA. Likewise, fewer than 1% of vaccine adverse events are reported. Low reporting rates preclude or slow the identification of problem drugs and vaccines that endanger public health. Next, I'll address you, Joe, since you know the science and the data. Are you aware of the CDC FluServe-Net database? That's a database in post-surveillance, it's a post-surveillance collection of confirmed influenza hospitalization cases across 70 counties in 14 states covering more than 29 million people. Did you know historically the first week in December is when that starts to uptick with positive increases in hospitalization cases? Now, when you said in the last meeting that this needs to stop, it's not going to stop. It's not a child to admonish. If we were to discuss cases, let's define what a case is. Let's back this up with hospitalizations and deaths directly related from every case. I'd love to hear about recovery data. I know plenty of people that have gotten this and it wasn't a death sentence, it wasn't the plague, and everyone was okay. The only reason we're not meeting in person is
20
to
seconds,
perpetuate
Jessica.
the perception of fear. I'm able to meet in person for the school committee meetings. We went from 2 weeks to flatten the curve to every public official becoming a Napoleon and making up mandates. And these mandates, they're the color of law. Do you know what that means? The color of law is defined as any authority using his or her power to willfully deprive a person of his or her rights and privileges protected by the
All right,
U.S. Constitution.
The 3 minutes is up.
Next.
This is Christina DeFalco. Do you hear me?
Yes,
I'd like to speak.
go ahead.
Okay, thanks. I am a mother of 3 young children, and I have lived in Westfield for over 21 years. I have a master's degree in biochemistry and molecular biology, and have significant experience working with viruses, biosafety testing of vaccines, and therapeutics. I'm worried for the children that live in our city. My concern focuses on the decisions already made and those being considered regarding masking and vaccinating children, which I believe to be unnecessary and medically damaging and socially damaging. First, let me say that I take this pandemic seriously, and I know that SARS-CoV-2 is deadly. I personally know people and family that have been deeply impacted by it over the past 18 months. However, studies have definitely proven that the vast majority of children are not at risk of getting severe disease from SARS-CoV-2. This is statistically accurate and not subject to my opinion. Unfortunately, the COVID-19 vaccine does not prevent the spread of the virus. The messenger RNA vaccine was designed to prevent severe disease, and this is the greater benefit of the vaccine. Fortunately, healthy children have natural killer cells that deals with the virus quickly, preventing serious illness without medical intervention. According to the Department of Secondary Education, the mask mandate will be in place until 80% of teachers and students have been vaccinated by school district. Parents are concerned about vaccination because of the low risk children have of getting seriously ill. The risk of death for children nationally is statistically zero. Without a policy change, therefore, kids will remain masked up through at least the remaining of this academic school year. Masks are devastating to many children socially, as numerous studies have shown. It would be irresponsible to not recognize this truth. Masks for children in school are not merely an inconvenience as they may be for adults, but hurts children's mental health, ability to interact socially, and develop the critical and interpersonal skills needed. With the reality that children are not at risk of serious disease or death from COVID-19, the defense of vaccinating children is so that they will not carry it to adults who may be. Vaccinating children has always been for the purpose of stopping the spread of a disease. But we know that the current vaccines simply do not stop the spread of the virus. According to the Massachusetts legislature and the Department of Public Health,
20 seconds.
are to be used by health officials to control the spread. As stated, quote, mandatory vaccination is substantially and reasonably related to the goal of preventing the spread of a disease. I am concerned that the Westfield Board of Health will be contradicting their own policies by demanding a vaccination for children that will not fulfill the purpose of immunization, which is to stop the spread of a disease. It is certainly a benefit that
3 minutes.
limit the severity of those infected with the disease. but
Thank you. We're moving on to the next person.
Okay.
Sandra?
If this is possible, I'd be really happy to give up my 3 minutes and hear the responses to the last two speakers.
That's not possible. Would you like your 3 minutes?
Sure. Thank you.
Thank you.
My name is Sandra Mackler. I attended last month's meeting, which was, of course, on Zoom, and tonight, obviously, we're on Zoom again because of the numbers have gone up. The vaccine is now readily available. We appreciate everything that's been done to make that happen. I understand that you all have responsibilities that have nothing to do with increasing the vaccination rate, but based on what I've seen, I still conclude that there have not been adequate resources devoted to increasing our vax rate. I've noted that you've made some recent efforts to provide more information on your website. We had 170 new cases last week and the vaccination rate increased to 56%. That's off your website, still significantly lower than most of the state. I do read your weekly articles in the local paper, and it's clear that you agree that Westfield's vaccination rate is not acceptable. It's not enough to provide access to the vaccination. We do have that. It appears that significant resources have been devoted to contact tracing, but based on what was shared at the last meeting, you plan to pivot away from that and now focus your efforts on city-sponsored vaccination sites. The underlying assumption is that more people will show up if it's city-sponsored versus going to a local CVS. I would respectfully suggest that you've no reason to believe that this will get more people vaccinated. I would suggest that instead you devote your resources to reaching out to the unvaccinated in our community. In addition to the weekly articles and website updates, the Board of Health should be actively and visibly promoting wearing masks when indoors, including how to wear them properly. I believe you have more potential influence than you realize. The message needs to come from the Board of Health. I don't understand why this meeting is on Zoom, yet we still see pictures in the local paper of meetings in City Hall with unmasked people sitting very close to each other. Maybe if the board instituted a policy requiring masks in City Hall and shut down all live meetings in City Hall, the word would get out to more people in the city that our COVID numbers are rising. There are other ways to reach people besides newspaper articles and websites. We need to be realistic and assume that the majority of the unvaccinated in our community are probably not reading the paper or checking your website every Thursday. Effective outreach takes time, effort, creativity, and collaboration with local businesses, community organizations, schools, and faith-based groups. As a concerned Westfield resident, taxpayer, and long-term soup kitchen volunteer, I think we need someone representing the board whose sole responsibility is to explore and implement strategies specifically designed to increase our vaccination rate. The Board of Health should be more relevant now than in any other time in my lifetime.
20 seconds.
You're in a position to make an impact. Please go public with your message and explore every possible means of outreach to those in our community who remain unvaccinated. Thank you.
you. The next hand I see
Gabriella?
is Adam and Katrina Ripka. Adam or Katrina? Did you want to? Sorry. Adam or Katrina? Okay. And then I see a hand and there's no name on it.
1 second, Juanita. Pete, can you, I don't remember what time the meeting officially started.
1804.
Okay.
Is that the one that has no name there? Oh, it doesn't come up on my screen. Gabriella?
Yes, I'm here. My name is Gabriella Mihalician. I'm a Westfield resident for the past 20 years. I believe we should consider finding additional ways to keep Westfield safer. Vaccination is not the only option. There are two pieces of information I think are important to us in Westfield. The first is that a high level of PFAS in the blood is correlated with difficulty absorbing vitamin D, according to at least one study. The second piece is a low vitamin D level has been shown to cause a significantly higher risk of hospitalization and death. This season being almost to the beginning of winter, we haven't had sunlight and we're not going to for a while. So we can't get our vitamin D through the sunlight. It's common knowledge in the medical community that vitamin D is very important for immune health as well as depression. And with the isolation, we need help for depression. And clearly with COVID, we need as much help for the immune system as possible. I would suggest considering, as a board, recommending vitamin D levels get checked for Westfield residents so that we don't have people with vitamin D deficiencies getting COVID and getting hospitalized. I strongly believe it will keep people out of the hospital, and that's backed up with a lot of research that I've read. I would also be interested to know if any of you would be open to a discussion of early treatment possibilities. I'm a board certified holistic health practitioner, and I have helped friends and family members recover with early interventions when their doctors told them all they could do was rest. I believe that information from all sources, including natural medicine, should be considered in an emergency health situation. There are people who are told to just stay home, that they can't do anything else except rest, that end up in the hospital, when if they had done something, they could have avoided hospitalization. So I would love to speak with you, and I will be emailing you to find out if you're interested. Thank you.
Thank you. And I
Okay.
believe this ends the 15-minute participation time. Correct,
Correct.
Joe?
Yes.
We'll move on to the first item on the agenda. First and only, I believe.
Yeah, first and only. So I haven't sent out the request to have the report published for this week yet because I wanted to take this opportunity at this meeting to give out the information that I have. We went up again this week. Many consecutive weeks of new cases rising. And we are right now at 194 total new confirmed cases, which is up from 170 last week. And to that, I'll speak as a statement of fact and statistics that we haven't seen a number that high since shortly after the Christmas and New Year of this past January. We are not even at that time yet. and we're already at 194 cases. The highest that we've ever been for one single week, other than in the very beginning, meaning March and April of 2020, was 290 cases, I believe, in 1 week. We're 100 away from that, and we haven't hit the holiday season yet. So I'll let you extrapolate what that means from the data. And what it means on our end is that we are extremely stretched for resources. The State Department of Public Health Contact Tracing Collaborative has disbanded. The majority of our cases for contact tracing went to the state, and they aren't taking any more new cases. So what we have is a number of new confirmed cases that is almost impossible for us to contact trace every single one of them. So it was just an unfortunate series of events that the state disbanded their contact tracing at a time when the numbers are higher than they've been for a long time. So one thing I would say is that when people think that COVID is a thing of the past, it's really just starting all over again. And that's where we're at. So what we're trying to do on this end, just to let the board and everybody listening know, is that at our last meeting last month, I reported that I'm very interested in pivoting out of contact tracing and doing more of vaccination promotion. But unfortunately, with getting the numbers that are coming in now and having to put these fires out with the resources that we have, especially when it affects the schools, we can't move on. We just are stagnant with our efforts, and we need to continue to try and control this so that it doesn't get bigger and spiral out of control, which I don't know if we can even do that at this point. So we're trying to pull in more resources with retired nurses and others who could help us do the contact tracing. I really felt last month as though the contact tracing wasn't the cure all to end all. But the problem is that when you have cluster events in facilities, whether it's a school, whether it's a church, whether it's from an event, if you don't try at least to stay on top of that effort to do contact tracing, as you can imagine, it's just going to spiral out of control. So we're actively trying to pull in, and unfortunately, I will report to the board right now that any effort for vaccination clinics and promoting vaccine, if we had more resources, we may be able to do that sort of activity in conjunction with contact tracing. But right now, all we can do is contact tracing, and we can't even do enough of it. So the schools are also of concern right now. So we need to make sure that we as the health department can pull in resources to relieve the stresses and the burden to the school department as well, because nobody wants to see us have to shut down schools and go remote. I don't know if the district is ready for that, so we're trying to really focus our attention on working with them every day, not exclusively, but extensively, in trying to make it so that we don't have these cluster events in any given school. And as you'll see from similar to last week, the percentage of school age kids continues to be at around 30% of our total. The problem with that is that even though that number doesn't go up, it's a little misrepresentative, because if we have, for example, this week we had 63 school age kids confirm new cases. 25 or 30 of those might be from one school. The others might be from another school, and then no other school would be affected. So that's where the problem with the exponential growth in that number from cluster cases comes in. So we're trying to control that now. The school department, the superintendent has been great in their cooperation. But the other thing I'll say in our efforts for contact tracing is that it's something that just absolutely needs to be done. as the number one thing in the effort to control this. The problem that we're having now, as I may have reported last month, is that the cooperation from the people that we're making contact with is less than acceptable. So we're kind of spinning our wheels in a little, probably 50% of the cases that don't want to participate in giving us the information that we need. And I get it. I get it. Everybody's sick of it. Everybody's done. But I can tell you statistically that it's not done. It's not even close to done. And it's just, if I look at the models that, like I tell you all the time, if I look at the models that are out there, and we're not at Christmas and New Year, and we're already at 194 cases, I would be absolutely shocked to see that number even plateau at best once we get into the first 2 weeks of January. So anyway, after we're done with this meeting, I'll send over the request to have our information posted on the website. We're still at 76% this week of new cases were from unvaccinated residents. So there is that need for the effort to get vaccination rates up. In Massachusetts as a whole, if you look at the information, the state will report out that we have vaccination rates at about 70% in Massachusetts and the entire Commonwealth. We're not even close to that in Western Mass. So what that means is that when policy is made and advisories are made, it does not trickle down to us, because if you look, if you're the powers that be, if you're the governor, if you're his advisory council, and you look at the fact that as a state overall we're at almost 70% fully vaccinated, you're done. That's it. But unfortunately, it doesn't translate out into Western Mass. So I'm not, so if statewide our percentages were 56% like they are here, we'd still be talking about mandates. We'd still be talking about gathering limits. We'd still be talking about all these other control measures, but they're not like that. So we're kind of on an island out here where we can't seem to get get over that vaccine hesitancy to get us to where respectively the whole other part of the state is. So I spoke to Bay State today. They still do have a vaccination van until the end of this month. So we're going to try and get that over into Westfield so that we can have another place for people to go and get vaccinated if they choose to. So anyway, just from looking at the numbers, I mean, we're up to 194. Like I said, the highest week we've seen in the whole pandemic, other than March and April of when it first started in 2020, that we're at a total that's just beyond what we've seen even within the last year. So we have to figure out how to deal with that. But anyway, we're continuing to try and do the contact tracing, bringing more people in. We have funding for people. It's very difficult to find people that are qualified and are well-versed with our surveillance software. So so that's where we're at right now. I'll answer any questions if the board has any.
Yeah, Joe, what is our where are we at 55, 56% of vaccine eligible individuals are vaccinated? What's the percentage?
So we're just around that 56% of eligible individuals that are fully vaccinated. I will give that a little bit of credit in the sense that there are some of the most recent round of kids that are eligible with their respective ages that probably haven't had a chance to be fully vaccinated yet.
Right.
So I would hope that when that actually happens, that the percentage will go up a little bit. But we're right on that border right now of that, you know, between first and second vaccination for the 5 to 11-year-olds. So But right now, we've been holding steady at around the 55-56% vaccination rate for the city, which is still lower than our other comparable communities, meaning Chicopee, Holyoke, and West Springfield.
Joe, do you think it would be possible to, I know the information comes out on the health department website every week as far as the cases go, but if there was a way it could be posted on Facebook or something like that, where people in Westfield forums, they'll see it, because I really don't think that many people, there are certain people that look every week, but the average person doesn't know our case numbers. And I think they need to.
Okay, so we have a Westfield Health Department verified Facebook page. We can post that information on there as well.
Okay, I know I've seen other city, I think through Lenore, things have been posted, City of Westfield, like a letter or something like that, getting people, information that way.
Mm-hmm. Yep, I can have that happen.
Okay, thank you.
So without the mask mandate coming from the state, can we put a mask advisory in place in Westfield?
So absolutely. I mean, the state actually already has an advisory regarding face covering. So that came out from, once they lifted the mandate, they went into an advisory as of July 30th of 2021. And I think that if you, and I didn't want to just arbitrarily draft something up until there was a discussion with the board about, how do you want that to be written? The state basically says, in public places and things like that, but it's already out there. I think that if the board wanted to entertain doing an advisory for face coverings, that it should probably just mirror the state advisory. I don't see any reason to add anything. And I've looked at all of the other communities and ones that they have, and one of them was the Tri-Town Health Department. They had a good, it was a directive, which is in between an advisory and a mandate. So that was very interesting language for them to adopt. That gets a little bit more specific with the warehouses and whatnots, but I think that that does also kind of mirror the state advisory for face coverings. So if the board wants to issue that advisory for Westfield exclusively, I think that you might want to have a discussion about how you would like that to apply. In other words, it's pretty simple in the state guidance in their advisory, where it's common sense stuff. We're not saying nobody's wearing a mask at home. It's public places pretty much exclusively. The schools are already taken care of, so that's a done deal. So an advisory, and I think probably more importantly with that, and it was said that the advisory, along with guidance as to how to properly do that with other control measures, I think all encompassing, that would be an effective thing to send out. I mean, I don't know how you all feel about it. If you want to have a discussion, if you have anything other than what I've already said, but go ahead.
I think going along definitely with whatever the state's doing, obviously. I'd like to take a look at the Tri-Towns directive and see what's different in that.
I think we need to have a discussion about an indoor mask mandate for public spaces. You've had basically 1% of the entire population of Westfield has tested positive in the last 2 weeks, and the trend line is not good. Most of our neighbors have mask mandates in place. So I think there's a discussion there. An advisory is going to do nothing.
Yeah, well, I mean, there's plenty
An
of,
advisory is a feel-good measure for the board, but would accomplish nothing.
and opens up a whole different discussion, and one of the issues that we found when we had the mask mandate before, we're really going to have to try and figure out how to police that. And there's just, before when we had the mandate, we were in a state of emergency, and we were able to recruit members of the Westfield Police Department to enforce the mandate.
So if you put a mask mandate in place and you go from, probably at this stage of the game, 90% unmasked indoors, and you move up to 50 or 60% masked indoors, then you've made huge gains without having to worry about any policing. Has anybody been out in West Springfield or East Hampton lately? It's just not an issue. You go inside public spaces and people are wearing masks and there's no pushing back, and it's a safer space.
Mhm. I've heard people from other communities say they've come into Westfield and been horrified at the number of people walking around without masks. And
I've gotten calls from a couple of hockey parents saying, you're on the Board of Health. My kid plays hockey in East Hampton and it's masked. My kid plays hockey in West Springfield and it's masked. My kid comes to Westfield and I don't want him to come to Westfield because there's no masking in Amelia. That's the feedback I'm getting, including from a doc.
Mhm.
Well, I mean, that all of that decision is at the pleasure of the board. So, we would just have to figure out the logistics of getting that into place. If there's a mandate, it would have to be voted on in a I guess kind of a specific way. But in other words, mandating where you have to mention where the mandate is applicable to. So if that were to be the case and you wanted to come up with a motion on that, and then we would just have to advertise that and get that out there for public knowledge. But again, when you go back and you look at the advisory from the advisory that used to be a mandate. So basically the state just took the word mandate regarding face coverings and they put advisory instead, but it's still the same language. And then there's all of the provisions for the exceptions too. So I don't know how, I don't know if you want to deal with that right now, or if you want to continue to have a discussion, if you want to make a motion, that's up to you guys.
Juanita and Margaret, I'm interested in your thoughts.
I would strongly be interested in a mandate. I believe, I know what the board faced last time with lots of people complaining and asking things to be enforced. And you're right, everybody doesn't follow every rule, but we live in a civilized society with lots of rules and regulations that aren't all policed, and people follow them for the good of everyone. So I would like to review the state mandate and other towns.
Okay, and rather than waiting until the next regularly scheduled meeting, what I will do is ask for, we can have an emergency meeting once we feel like that, the motion is ready to be made, if that's what you choose to do. So it does not have to wait until January. It is something that we are able to do. So if you want to take it under consideration, do the research, come up with what the parameters, and I will also what the conditions of the mandate will be, then we can reconvene as soon as you're ready, so long as we have time to adequately post when the next meeting's going to be.
And also, I agree that we should do the research, and I think that as long as these numbers keep going up every single week, something's got to be done. And the only thing, we can't force people to get vaccinated, but we can mandate that they wear masks in public places anyway.
Well said, Margaret.
Yep. So perhaps we can all do our research and maybe have an emergency meeting next week.
Yeah,
Okay.
mostly, Joe, what I want to know in terms of, research is just what did the mask mandate look like last winter? When we were at, when we were north of 200 cases a week for that 1 week in January. Because I just don't see why you have to reinvent the wheel. So if we could get the language from last winter's mandate, I don't see why, without perhaps a little tweaking, that wouldn't work now.
I agree 100% that was the state mandate for masks. I'm sure it's readily available. We can refer to that. I would say that if you want to move in that direction, that would be the document that you would look at. I'll find it and I'll send it to you all so you can see what the original governor's mandate was. The one thing that I want to be careful about is that there's nothing in there that was special consideration because of the fact that we were in a state of emergency, which we're not now. So I just want to make sure that, there's nothing in there was extra special or enforceable because of the fact of the state of emergency. But the general language should be pretty straightforward as far as where the mandate was. And there is still a mandate, by the way, on public transportation. There is still a mask mandate
Schools.
for other things. So, but I think you're right, Stan. I think we should look at that if that's the way you want to go with it. Make sure we pick out anything that wasn't special and applicable to the fact of the state of emergency. And then, you can decide how you want to vote on that.
And then just one other suggestion, Joe, if I may, if you could reach out to your counterparts in East Hampton and West Springfield, and just ask them about, pearls and pitfalls when they reinstituted their mandates this fall.
Mm-hmm. Sure. Yep.
Sounds good.
All right. Okay, so we'll do a little legwork on that. I'll send you everything I can find, and then we'll plan to reconvene. I would think that it would probably be advisable if we were going to hold an emergency meeting, if it would be a week from today, just to keep some sort of relative consistency, Wednesday at 6 o'clock. So hopefully we'll be able to pull that information together and be able to post it. I have to post it by Monday.
I can do that.
Okay, good.
I believe I can too. I don't have my calendar in front of me, but I usually have Wednesdays off.
Okay. So that is for the update for you all. That's pretty much all I have. I think we know what we need to do moving forward. So, Juanita, I'll leave it up to you to decide.
With health.
What do you want to do? You want to keep talking?
Do you have more information, or
No, I'm good. I said everything I've needed to.
Joe, Margaret, do you have anything else to discuss?
No, not at this time.
Stan?
No, I'll plan on reviewing what Joe puts together for us and his feedback after discussions with West Springfield and East Hampton, and plan on next Wednesday night at 6 p.m.
All righty. So meeting adjourned at 18:48.
Thanks, everybody.
Good night.
Thank
Night.
you.